How's it going, guys? A medium difficulty question, pulmonary, steps 1 and 2. 45-year-old dude, he's got a normal PO2 95, should be 80 to 100. PCO2 normal 40, should be 33 to 44. O2 content low. What's the most likely explanation? Choice A, alveolar hypoventilation, wrong fucking answer, because if this were the case, CO2 would be high, which we don't have here. So it could be things like drug-induced, benzos, barbiturates, opioids. They'll give you, on the USMLE, 12-line bullshit paragraph. You have no idea what's going on. And they'll tell you the PCO2 is 70. And then we look at the answers, we just see alveolar hypoventilation, very buzzy answer choice. But once again, can't be correct because our PCO2 is normal here. Choice A, wrong fucking answer. Choice B, high altitude residence, wrong fucking answer, and it's wrong because your O2 content would be normal, not low. So acutely could have hyperventilation to compensate for the low O2 tension in the air, where CO2 could go down. You have an isolated respiratory alkalosis. Bicarb has not yet changed. But patients who live at high altitude are going to have increased EPO secretion with higher hemoglobin levels, and the hemoglobin levels can actually have a lower saturation, e.g. 93, 94%, but the lower saturation coupled to the higher hemoglobin level itself, the O2 content will be normal in the blood. Choice B, wrong fucking answer. Choice C, methemoglobinemia, correct answer. So this is when O2 can't bind to hemoglobin because rather than the iron hemoglobin being Fe2 plus ferrous state, it's Fe3 plus ferric state. So what we have going on here, I'll make this real clean and easy, is you have O2 content that's low and your PO2 is normal. Well, what is O2 content in the blood equal to? It's equal to the dissolved oxygen, which is your PO2, about 2% of the oxygen floating around the blood. And then you've got 98%, which is your oxygen-bound hemoglobin, your HbO2. So for you to have a low O2 content despite a normal dissolved oxygen, the only way that's possible is if your HbO2 is low. Now what NBME will do is they'll give you a nearly identical question, and the answer is just anemia. And the reason that's the case is because that's a possible explanation for how you could have low HbO2. So anemia is just low hemoglobin. So in this case, anemia is not listed, but we could have had CO poisoning. Some dude in the winter with home heating system where he has carbon monoxide poisoning. That could be an explanation as well for low O2 content despite a normal dissolved oxygen in the blood. And here we have methemoglobinemia. It could be a patient who works in a butcher shop with deli meats. It can be a patient who was out drinking water in the wilderness from streams, lakes. Those are two buzzy demographics. Or they can just give you a question like this where you have to deduce based on elimination that it's correct. So methemoglobinemia is a possible explanation for how you could have low O2 content in the blood despite a normal PO2. It means your HbO2 is low, where the O2 simply can't bind to the hemoglobin because it's Fe3 plus iron rather than Fe2 plus. So let's just eliminate the other answer choices now. AA, mismatch, wrong fucking answer. Okay, so the way you know this is wrong is because your PO2 is normal. So let's say your lungs are fucked up, e.g. you have pulmonary fibrosis, where the air you're breathing in is fine. It's the alveoli, the oxygen's normal, but because of the fibrosis, let's say, the arteriolar oxygen, the capillary oxygen's lower. So you have a high AA gradient, you have mismatch there. Well, our PO2 is clearly normal, so it means our lungs aren't fucked up. That's how you can simplify it. Okay, you see the PO2 is normal, that means your lungs are not fucked up. Choice D, wrong fucking answer. Choice C, voluntary hyperventilation, wrong fucking answer, because it's probably the worst answer here, because if this were the case, wouldn't your CO2 be low? 33 to 44, so it's just a garbage throwaway answer choice, wrong fucking answer. You know the deal. When you make more content, you'll stop scrimmaging. Appreciate your time. That's it.